Olá, pessoal. Quase certo, a gente já vai começar.
Good afternoon. Now we will start the sessions, and I will moderate the session 3 that is focused on oral health and dentistry. My name is Mariana Braga. I'm associate professor at dental school at USP, University of São Paulo, and I will moderate this session that will be present, and I will present the presenters to you. I've been working in the painel USP de Gêmeos, a little bit in Portuguese, a little bit in English, because we participate in this project. Fortunately, it's a pleasure and a honor to be part of that. And we will developing in the dental school, the Kardec twins, that it's focused on the part of dental health of part of these twins included in this big panel. So now I will invite Dr. Julia Gomes Freitas that will present to you the first lecture, Influence of Genetic and Environment Factors on Oral Health Problems. And Julia has degree in dentistry for the University of São Paulo, and she is currently doctoral student in the same school with emphasis on pediatric dentistry, and she is member of the Kardec group that developed the Kardec twins at our school, and she will present to you this part of the session. Thank you, Julia. After the applause, we will have time for questions at the end that I missed this information. Thank you.
Thank you, Professor Mariana, and thank you for all to be here today. And I know that Professor Mariana already presentation me, but I'm Julia, and I'm a PG student at School of Dentistry here in University of São Paulo. And first, I would like to thank you, everybody, for this opportunity to share with you my PhD project. So today I will talk with you about the influence of genetic and environmental factors on oral health problems. And this presentation was made by me and Laura, that you will meet soon. And, oops. To start, oral health is a complex field, so know about the interaction between genetic and environmental factors is so important because plays a crucial role in development and progression of various conditions. So twin studies are fundamental for us to understanding this complex dynamic. know more about this influence can help us to know, to predict and prevent disease or health disease, but also know more about therapeutic approaches and behavior management. We already have some areas of dentistry with twin studies like oral hygiene, dental caries, periodontal disease, malocclusion, and enamel development defects. So I will show you a little bit of these examples. The first study is our oral health knowledge and habits of Hungarian monozygotic and dizygotic twins, a pilot study. And this study is so interesting because they find and suggests that both these groups, monozygotics and dizygotics, are similar in their habits. So there are no difference when they consider the zygosity. But at the end of this discussion, the researchers talk about do more researches with increasing the sample. The second paper is dental caries and microbial acid production in twins. And this one, they talk about dental caries have a significant genetic contributions, and the microbial acid is essentially modulated by the environment. Here we have one of prevalence and irritability of early childhood caries among monozygotic and dizygotic twins. The etiology of hypomineralized second primary molars. Here a study about the genetic and environmental contributions to the association between mood disorder and periodontal disease. And here about a study about malocclusion. So we have so many different areas in dentistry that already work with this subject, and our group also. So our research group, Cardiac Trials, is also conducting a study with twins. And now I will share with you some results about this work. This is my PhD project. So the title is Influence of Zygosity on Dental Caries, Behavior During Dental Treatment, and Quality of Life of Children, a Cohort Twin Study. These studies, 3 institutions of here, University of São Paulo, are participating. So the School of Dentistry, the School of Medicine, and the Institute of Psychology. And our aim was to evaluate the association of fake factors related to the twins pairs with the oral health conditions, quality of life, as well as the behavior and success of dental treatment. So the 3 partial results that we see today is the first one about dental fear and anxiety, the second about dental caries, and the third about oral health quality of life. So dental fear and anxiety in children at a cohort twin study. When we talk about dental fear and anxiety are a set of negative feelings that the child or the adults feeling during the treatment. We have some data that 1 out of 10 children have some degree of anxiety, and fear in Brazil affects 21% of children. So fear and anxiety can influence the behavior during dental treatment. So why not we know more about the origin of these feelings? The aim was to evaluate factors that influence children's dental fear and anxiety in dental environment in a twin cohort study. We selected twins born between 2007 and 2017 at Hospital das Clínicas, São Paulo, Brazil. Invited to participate in a cohort study and collecting information about the zygosity, sex, age, oral health conditions. And for this part of this work, we applied the modified child dental scale. And the main question of this scale is, how do you feel about some situation? So we present for the child, how do you feel about situations that happens in dental office? And the child answer among relaxed until very words through these phases. The clinical exam was performed and also a treatment plan considering children's dental needs. We performed some analysis. And for the results, 144 children were evaluated, so being 68 monozygotics and 76 dizygotics. And to the exciting about the results, there is no association with age, needed treatments, and zygosity. Around 34% of the variance anxiety is related to the siblings. It did not change significantly when we added the zygosity to the model. And about the child, boys had lower MCDAS-F, this is the scale scores, and lower chance of having anxiety. So for the conclusion, girls presented more dental fear and anxiety than boys. Moreover, this outcome is more influenced by the sharing environment than the genetics of the twins. The second topic that we talk about is caries indicators in twin children, a comparison between monozygotics and dizygotics. Our aim was to assess the concordance of caries indicators in twin children and the influence of zygotic on the occurrence of dental caries. So are the same sample, and we performed a clinical exam with ICDAS to calculate the index of decayed, missing, and failed primary and permanent teeth. Here we divide in two groups. The first one consider all lesions, so scores A, B, C of ICDAS, and the second group considering cavitated lesions, only score C. We performed this analysis with the same sample, no significant differences were observed between monozygotic and dizygotics for all caries indicators. But we can observe that for the monozygotic ones, we have higher agreement of the caries indicators, considering for deciduous, considering cavitated lesions, and all lesions for the monozygotic ones. So ICC values are higher. And for dizygotic twins, the higher ICC value was for all lesions of permanent teeth here. And the irritability values in most of cases were higher than 0.700. The conclusion is the greater concordance between the monozygote twins show us a genetic influence on the occurrence of dental caries. And the third topic that we talk about is comparison in the response pattern of twins to a children's oral health related quality of life questionnaire. So the aim was to assess the influence of zygosity in the response pattern of twins to the Child Perception Questionnaire, CPQ 1114. And we applied the short form of this questionnaire before the dental treatment. We performed this analysis considering the zygosity. And this analysis was performed with a small sample, so 56 twins were included. And the mean difference of the CPQ total scores, I think it's hard to see, but I'll talk to you. Total score for monozygote twins was minus 2.1, and for dizygote twins was minus 0.1. And we observed a higher agreement in the pattern of responses. In monozygote twins, ICC value is 0.622 compared to dizygote twins. ICC value was 0.443. So for the conclusion, monozygote twin children have higher agreements than dizygote ones in the response pattern to our oral health perception questionnaire. And understand all these interrelationships is very important to us because oral health professionals can develop more effective prevention and treatment strategies, think about improving patients' oral health, and general well-being. And with this, I finished my presentation with some patients of our clinical. And here the patients, and here we have some dentists that work with us. So thank you so much, everybody that contribute with this work. And I think it is. Thank you.
Thank you, Julia, for your presentation. So we can move for the next one. And the next presenter is online, is Professor Marina de Deus Moura Lima. Can you hear us, Marina?
Yes.
Yeah. So Marina, just a second, I will present her. Marina is a specialist in orthodontics and pediatric dentistry. And is also has a PhD in oral pathology in the University of São Paulo. And currently she is associate professor in the Department of Pathology and Dental Clinic at Federal University of Piauí. He teaches in pediatric dentistry and child clinic and is faculty member in the graduate program in dentistry at the same university, where she conducts research related to the study of development defects of dental enamel. Thank you very much, Regina. It's aqui, it's here. Thank you very much, Marina, for being here with us, and the floor is yours.
Okay, good afternoon. First, I'd like to thank Dr. Emma for the invitation to participate in this meeting, and Dr. Mariana Braga for the kind presentation. So after the excellent presentations in this morning, I'd like to say that it's a big pleasure to be here to talk about molar-incisor hypomineralization in mono and dizygotic twins. Molar-incisor hypomineralization is a developmental defect of the dental enamel, which is the most mineralized tissue of the human body, covering the clinically visible surfaces of the tooth crown. But how this condition occurs? The enamel formation, known as amelogenesis, is characterized by a highly complex process, beginning in early embryonic development and extending throughout the lifespan. First, during the secretion phase, organic matrix is secreted, and during the maturation or mineralization phase, the matrix is mineralized. During the progression from the earlier to the later stage of amelogenesis, a dynamic and complex process takes place. So during this process, a dynamic process occurs. Biochemical, genetic, and epigenetic changes happen in the developing tissue. High rates of mineral acquisition, variations in extracellular pH, and resorption of enamel proteins occur too. The cells responsible for the dental enamel development are the ameloblasts, which are known by their high sensitivity. So, disturbance that occur during the amelogenesis can cause developmental defects of the dental enamel that represent one of the most prevalent oral conditions in childhood and consist of abnormalities in the quantity or in the quality of enamel that affect tooth formation, hardness, and also coloring. Different kinds of enamel defects may occur. And in the last year, a particular pattern or enamel hypomineralization was identified, Molar-incisor hypomineralization. And this defect affects 1 to 4 first permanent molars, and permanent incisor may or may not be affected. Clinically, it presents asymmetric severity with demarcated opacity that can vary in color shade from white to brownish, with a clear demarcation between the affected and the healthy enamel. MIH represents one of the great challenges of current dentistry. An increased enamel porosity makes the involved teeth more vulnerable to post-eruptive breakdown. Furthermore, in more severe case, the porosity renders teeth more sensitivity to stimuli during tooth brushing or chewing, thereby posing an obstacle to oral hygiene, predisposing teeth more vulnerable to dental caries. In fact, individuals with MIH are 2.1 to 4.6 more likely to present dental caries, as we can see in this picture. The affected teeth can also result in compromised aesthetics due to staining and morphological alteration. Thus, individuals with MIH may experience anxiety and social embarrassment regarding their dental appearance. Besides, they may present occlusal changes. This factor can affect their quality of life. According to a systematic review with meta-analysis published last year, children with MIH are about 6.25 times more likely to have negative impact on oral health-related quality of life. Besides, the affected enamel makes it difficult for restorative materials to adhere, which cause overloading of the health systems by demanding for replacement of restorations. Furthermore, hypomineralized teeth are recognized for their tendency to pose challenges in responding effectively to local anesthesia, complicating technical aspects of their care. The global prevalence of MIH is 13.5%. Currently, there are about 878 million of people affected by MIE worldwide, with an incidence of 17.5 million of new cases per year. The etiology of MIH is multifactorial and not fully elucidated, with a probably association of genetic, epigenetic, and environmental factors, but we do not know the exact influence of each factor yet. Last year, our group have published the first systematic review to focus on the association between genetic aspects and MIH, and an association was observed between MIH and genes associated with amelogenesis, immune response, xenobiotic detox, and ion transport. Interactions between genes related to amelogenes and immune response, as well as aquaporin genes, were also associated to MI8. This paper is an interesting family-based genetic association study. They evaluated the presence of genetic association in 63 single nucleotide polymorphisms of 21 candidate genes related to amelogenes. DNA was obtained from 391 individuals who were birth family members of 101 Brazilian nuclear families. 63 single nucleotide polymorphisms were investigated in 21 genes related to amelogenesis, and significant results were obtained for these genes. It was concluded that variations in genes related to amelogenesis were associated with the susceptibility to develop MI8. So the results of this study are in agreement with the multifactorial idea of the MI8 etiology. But the authors concluded that further studies are necessary to investigate more deeply the factors that could influence MI8. Specialists, many authors have emphasized that studies with twins provide important insights into the contribution of genetic and environmental factors in the expression of enamel defects. Comparison of concordance in monozygotic and dizygotic pairs can help determine the influence of genetic factors to the variation in the risk of MI8. Besides, the studies with twins allow the evaluation of genetic and congenital influences on phenotypic variation by the existence of genotypes in similar environments, as well as the possible interactions between them. So, studies with twins represent the most direct way of assessing the genetic contribution in the occurrence of conditions. There are few articles published regarding this matter, regarding developmental defects of dental enamels and twins. Our research group performed a study which was published in 2018, and we consider the most important study from our group. Our objective was to evaluate the agreement of MI8 between monozygotic and dizygotic twin pairs and the association with environmental factors. So we studied children aged 8 to 15 years old. There were 167 pairs of dizygotic and monozygotic twins. In this study, the overall prevalence of MI8 in twins was 29%, a higher result than that obtained in an epidemiologic survey of individuals who were not twins. That was 18%. This difference may be due to the greater fragility of health after the birth of twins, which is frequently associated with enamel defects, as we saw in the lecture from the professor in the morning. In this table from the same article, we can observe the agreement for the diagnosis of MIH between monozygotic and dizygotic twins, an analysis per tooth and per individuals. It was observed a greater concordance in the diagnosis of MIH among monozygotic twins and in the assessment by affected index TIF2. About 75% were matched in monozygotic twins, which indicates a genetic influence. But although there was a greater agreement between the pairs of monozygotic twins, in 15 pairs, only one individual from each pair was diagnosed with MIH. This fact points to the multifactorial etiology of the condition. Posteriorly, Dr. Vieira has used the data from our twin study to calculate the heritability of MIH, and he found that it was 20%, and that the difference in concordance rates between monozygotic and dizygotic twins strongly support a genetic component to MIH. And the same author said that future studies aiming to understand mechanisms should be designed to consider genotypes and environmental risk factors in combination. So, until now, the role of genetic factors in the etiology of molar-incisor hypomineralization has been little explored. Many questions remain to be answered, and studies with twins can help answering many of these questions. We believe that studies with ethnically diverse populations should be performed to obtain more consistent results. So, lastly, I would like to thank our research group that's formed by many graduated and postgraduated students, Professors Lúcia, Cacilda, Marceli, from the Federal University of Piauí, Professor Fausto Mendes from the University of São Paulo, and also Professor Emma Otto that recently contributed to our research group. Nowadays, we are performing a study which aims to evaluate many oral conditions as caries, developmental enamel defects, fluorosis, and bruxism in twins, but in another age, from 3 to 5 years old from Teresina. Thank you for your attention.
Thank you, Marina, for your excellent presentation. And then we will move on for the next one, morphological variations of the face in twins. That it will be, I will invite Professor Laura Pontes. Let me see here, technologies. She has degree in dentistry for the University of São Paulo as well, and she has her PhD in dental sciences with concentration in pediatric dentistry at the same school. And she has experience in project management and coordination of clinical studies working in cardiac trials, and is assistant professor in pediatric dentistry specialization courses at Fundecto UFPI. So, Laura.
Thank you. I'm Laura, and I'm not the Professor Edgar. And I will show the project with the twins. We are working with morphological variations in the face and these children. So we need to different the recognizing and identification. The recognition, we needed to recognition something. So do you recognize it? It's a New Yorker based baseball cap, but can anything, any cap we have. In the facial recognition, we need we have many things we recognition our face. And the cell phone, for example, recognize the face of me or my sister and open the softwares. For identification, we can identification this cap as my cap because this cap have some marks here, and this cap is my cap, is no other cap. Oops. For the facial identification, we have the police identification for the passport, for example. Então, the identification carry out the police check any points on face to certification this person, he's this person. For the twins, identical twins, we need to identify an identification specifically. Oops. And in this case, it's crucial because we have the points of the policy, for example. We need the investigation, decisions, so we need to the identifications, the twins. For this, we use the artificial intelligence. New approach with the research in the facial recognition and the policy identification in twins with this context. This study research explore innovative methods and technologies for discussing between identical twins using artificial intelligent algorithms. So we, oh meu Deus, esse negócio é complicado. So we have 50 pairs of twin images, and we use the Python to analyze it with these methods. This is the same person in two images. All image was standardized for grayscale, the brightness and the contrast to adjust the quality of the images for the software. And after that, we have the lines identification and identified the same person on the eyes, on the lips, the nose. And these lines prove for me this person is the same person here and not his brother. So we use the 50 pairs of twin images and show similarity from these images with us compared to the same brother and separately his brother. For the conclusion is the application demonstrate consistent potential to optimize the workflow to face recognition and the policy identification to the practice of official forensics. This our work. Oh. Thank you.
Thank you, Laura, for your presentation. Very intriguing presentation. And with this presentation, we end the first part of this session, and we have time for some questions. Some questions from any questions from the audience? Anyone would like to make some question for any one of the presenters? No, from the online we have. The first question from the online audience is how the zygosity was measured. Could be you, maybe. And I think we can begin with Julia, and then Marina can add.
Okay, thank you for the question. The zygosity was measured from the database from the clinical hospital, the Hospital das Clínicas da Universidade de São Paulo. So we have this data, and also through a questionnaire that we ask for the parents and for the child how they feel, how they are similar. Yes, thank you, Tanya, for helping me. So for the database, for the questionnaire, and also for the mothers. So we have 3 data, and we do the analysis with this data. I think for our work is that.
Marina, would you like to complement something?
Yes, the question is very important. I think it's a great problem in twins studies is the question of evaluating the zygosity. In our study, we did not make any DNA analysis, but we asked for the parents. We know that it's not the ideal method of analyzing. And in the present study that we are performing now, we are using a questionnaire developed by Dr. Emma, in which we ask, I don't remember now if 4 or 5 questions related to the appearance of the children. And this questionnaire, 4 questions. Thank you, Dr. Emma. So 4 questions, and this questionnaire is validated.
Well, so we have any other question from the audience? We have, we have to.
Thanks for some really fascinating talks. Do I remember correctly that you found a large shared environmental influence for anxiety, children's dental anxiety? Is that correct? Was that right? Yeah. So did you find a large shared environmental component for anxiety about dental work? Was that correct? Yeah, I just wondered because that's quite unusual, isn't it? So I wondered about that.
Yes, it's about anxiety, right? If they feel a lot of anxiety, I don't understand the question.
Ela perguntou se você encontrou, você está enfatizando a influência ambiental, porque acho que houve pouca influência genética em alguns itens. Ela está te perguntando sobre a influência genética e ambiental nos seus dados.
But all data or just the anxiety data? Okay.
Sorry, she has to explain.
For the anxiety data, the analysis is about the two, the genetics and the environmental, but we found more environmental influence, not genetics, and we don't discuss too much about this yet because this project is ongoing, but we think that the environmental influences more because the context that a child are living. So I think this can influence more than genetics. You're welcome.
Any other question from the audience? We have one from the online audience here, from Julia again. Did you had access to the motives of why the children were scared to go to the dentist? Could you get the question?
So thank you for the question. We don't have the reasons for the dental fear and anxiety before the dental appointment. So when they answer the questionnaire, we can see which situation is more cause more fear or anxiety. But before this, not. Just with the questionnaire, they answer some specific situations like how do you feel about going on dentist in general? How do you feel about took out the teeth? So we have these reasons, but just about the appointment, not before the historical of fear and anxiety.
Thank you, Julia. Any other question?
Hello, my question is about facial recognition because I was trying, I'm not sure if I got everything and I just would like to clarify. So the system would capture like 50 different images of the same person in different expressions and create measures of how this face changes in different expression of smiling, of maybe being serious, and compared to the same other twin with other 50 different facial expressions. Is this comparison that is being done in the system? I don't know.
The system to compare the two images for the one, the pair and the brother with so far images, and this algorithm is created by Professor Edgar. Yes, two images with the yes.
Because if you only have two expressions, I was wondering, if you have a patient, a child or adult, who has a facial palsy, part of the face, maybe you don't have as much information you need to create this comparison with numbers. So maybe, because I know some banks, they do use several images of yourself. Like every time you do a transaction, they capture a new image of you. So they have a comparison with the time because your face changes, right? So I don't know if that's the same.
It's the same logical to passport. It's one image. You can smile in anything. You can stop there and
also the same principle for identification in our buildings. Sometimes we have to do the same. It's very new in my building. It's incredible because you smile or you are angry and appear Mariana Braga, you can enter. And then my kids play with that because one of them is registered in the building and he talks, please, let me smile to the camera. And then the app say, Felipe, you can go wink. Any other question? For the audience here, we have more questions. The online question is to Marina. And the question is if there is any way to avoid the IMEUSP. A tricky question.
It's a very good question. There's no way to avoid MIH at this moment, but it's important to diagnose early to prevent damage to the teeth. So until now, the most of the studies are cross-sectional. So it's very difficult to identify the environmental factors involved in this condition. What do we know now? That there are many pre-birth, during the birth and post-birth factors that can cause MIH, but we do not know yet clearly these factors. So as I said, MIH is really a very good challenge. I think all the dentists, Mari, we know that it's a very big challenge, and we have to continue studying the etiological factors.
Thank you, Marina. I think we have no more questions. Okay, very quick to not be late.
Marina, I was very curious to know have you ever heard of any study using animals? If this HI, I forgot the full MIH is identified in animals, because you were mentioning genes and something else. And if because some genetic stuff, we can do genetic treatments, like using viruses to introduce new genes. I know they are very momentary, but I don't know, just a curiosity.
Yes, MIH was introduced, was described in 2008. So there are very few studies evaluating it. There are some studies, animal studies, in which they studied bisphenol A, BPA, in rats, but the results of this study are discordant, but the genetic therapy is not, there are no study to related to this.
Thank you, Marina. So we are in the end of this part of the session. I would like to thank all presenters and all the questions for the audience. And now we have time for a small break. We will be back 3:30, and we will see you soon. Thank you very much.
Hello, Natalia. Hello, everybody. Are we ready to continue? So, on behalf of the organizing committee, Professor Emma Ota, Professor Maria Lourdes Brizo e Professor Edgar Michel Crosato, workshop, Twins Studies. Thank you for being here with us. You and I will be the hosts of this section. Thank you. Natalia is from University of Federal of Pará. That's it, Natalia? Okay. And
yes, that's correct.
it's correct. Okay. Someone is telling me that my signal is not very good, so I can repeat. On behalf of the organizing committee, Professor Emma Ota, Maria Lourdes Brizo e Edgar Michel Crosato, let's start our final session. Natalia Dutra we will be the hosts. The last talk, C. Gregory from University of London. She has a very strong career, and we are very excited about her talking. I'll let her say the title, but I think he will talk about concurrent and longitudinal associations between sleep and internalization difficulties. I'm not quite sure if I'm a mathematician, so sometimes I have difficulties to understand what is going on. Okay, Natalia, would you like to welcome Professor L.C. Gregory?
Yeah, sure. I would like to thank Emma and her team for the invitation. And thanks, Claudio, for the introduction as well. I think it's always exciting to have a mathematician in a team. So don't feel too out of your comfort zone, because it's always good to
Thank you.
Have
You're very kind.
interdisciplinary team. Yeah, that's all right. So I'm a psychologist, and I'd like to introduce again Dr. Alice Gregory, and very curious to hear her talk.
Yes. Okay, Professor Elsie, we will be your hosts, and it's your time. Thank you very much for being with us today.
Wonderful. Thank you. Thank you very much. And thank you so much for this invitation. I'm absolutely delighted to be here. Thank you to Emma. Thank you to Tanya, Ricardo, everybody that's made this possible. And as some of you know, I've brought my mum with me today. My mum grew up in Brazil. So it's an opportunity for her to come back, and she's loving speaking Portuguese, which is her first language. Unfortunately, I am not able to speak Portuguese, so I apologize for that. But again, thank you all for this lovely invitation. So today I will be talking to you about sleep and mental health and twin studies, which I've been focusing on for some of my career. And of course, to start with, the acknowledgements of the many people who I've worked with over time and who have been involved in some of the studies that I'll be talking about today, and some of the funding and disclosures as well for various things that I get royalties for. So, why am I interested in sleep? Well, John's already done a fantastic job at explaining why sleep's interesting. So apologies if I go over some of your content again. But I've been interested in sleep for a very long time from a research perspective, and particularly in relation to mental health as well. And I hope I can justify today why I think this is such an important topic. And then, of course, because of the focus of this talk or this whole presentation, whole conference, I'm going to focus on some of the twin studies that I've been involved in over time, focusing on some of these questions. And then I'm going to end by talking a little bit about an area that I've got interested in quite recently, and that's to do with the public communication of science. So how we describe what we've discovered to the general public and the possible implications of that, because we've found some preliminary results that we think are quite interesting in that area. So why consider sleep? Why do I think this is an important topic? Well, we know that we sleep a lot. Here are some recommendations that have been proposed as to the amount of sleep that we need at different stages throughout the life course. And you can see that the amount of sleep we get roughly halves from the very earliest stage in life to older adults. But of course, we all spend an awful lot of time asleep. And we now know it's very important, and we're finding out more all the time about why sleep is important. We know it's important for restorative reasons. It's important for the brain and body's growth and repair. We know it's important for information and memory processing as well. New brain circuits can be laid down when sensory input's minimal. We're not receiving this information while we're lying asleep, for example. And it also allows us to prune these unnecessary connections. And actually, our understanding of this area, as I mentioned, is changing all the time. So I would have said to you that sleep is very important for washing toxins from the brain. And that's a theory that's been leading for some time, and I often tell my students about. But just as I was boarding the plane, I read a study saying, you know what, we've just found exactly the opposite in our study. So, we're thinking all the time about, what this information might need and how to draw it all together. But we also know in the context of mental health that sleep is important for emotional recalibration. It helps us regulate our emotions. I mean, I'm sure many people have that experience of missing out on a night of sleep and finding it difficult to control their behavior the following day. So I love this quote. It's from Alan Rechtschaffen, who was a professor at the University of Chicago, and he is quoted as having said, "If sleep doesn't serve an absolutely vital function, then it's the greatest mistake the evolutionary process ever made. Why should we spend such a huge proportion of our lives sleeping if it's not incredibly important for evolution?" But we also know it can go wrong, of course, and anyone who's familiar with the International Classification of Sleep Disorders will have seen these different categories. So there are 6 main categories, which include insomnia, sleep-related breathing disorder, central disorders of hypersomnolence, circadian rhythm, sleep-wake disorders, parasomnias, and sleep-related movement disorders. And within each of these categories, there are lots of different disorders. So there are an awful lot of sleep disorders that we know about. But just for clarity, most of my research is focused on either insomnia or general sleep difficulties. So when parents, for example, are reporting that their children don't sleep well, or people are self-reporting about poor quality sleep. So what do we know about sleep in relation to mental health? Well, I think we're learning more all the time, and we're now seeing that these associations appear to be very robust. And a decade ago, I reviewed the literature with a very dear colleague, Avi Sadar, who was a professor in Israel, who sadly died the shortly after this was published. But at the time, we went through the DSM and we looked at different categories, and we both did lots of literature reviews as to see what was known about sleep in relation to all of the disorders that we were looking at in the DSM. And to give you the general finding, we found that almost all mental health conditions appear to be associated with atypical sleep patterns and problems. And the data varies. Of course, some studies look at poor quality sleep, insomnia symptoms, missing out on sleep, restless leg syndromes. But overall, we're seeing that pretty much all of these disorders that have been looked at do appear to be associated with different aspects of challenges with sleep. So I'm going to give you an example to go into a little bit more detail. So if we think about anxiety and depression, we know that the associations with sleep are so well established that they're even included in the diagnostic criteria. So for example, when we look at the DSM-5 criteria for generalized anxiety disorder, we can see that the anxiety or worry is associated with 3 or more of the following 6 symptoms: restlessness, fatigue, difficulty concentrating, irritability, muscle tension, and then importantly for this lecture, sleep disturbance, difficulty falling asleep or staying asleep, or restless, unsatisfying sleep. Then when we move to major depressive disorder, 5 or more of the following symptoms need to have been present for the same 2-week period: depressed mood, lack of interest, weight change, insomnia or hypersomnia nearly every day, psychomotor agitation or retardation, fatigue, loss of energy, worthlessness, concentration issues, recurrent thoughts of death. So sleep are some of those central symptoms that are flagged when we're trying to diagnose these conditions. So I flagged that sleep is important, but just how important? And actually, this data that came from a study by Ian Goodyear and colleagues was very striking to me. So this table comes from a study that looks at treatment for depression in 11 to 17-year-olds with unipolar depression. That actually, for me, is not the main point of why I'm showing you this. In fact, I'm showing you symptoms at baseline. So that was before these young people received any treatment at all. But at baseline, they looked at the different symptoms being experienced by these young people diagnosed with unipolar depression. And I've put this red rectangle round the sort of total sample. So this is at baseline. And these are the different symptoms being reported. And if you look at that top figure, you can see, and I can't actually see, but I think it says 92% of these participants reported sleep disturbances at baseline. So that's a huge proportion. And in fact, even more so than those reporting depressed mood. Again, really emphasizing just how central sleep is when we think about some of these psychopathologies. So when I started my own PhD a long, long time ago, one of the questions I had was, do sleep problems constitute a red flag for the development of later disorders? We knew that sleep was related concurrently with a variety of other psychological difficulties or psychiatric disorders, but we didn't know how this developed over time, and especially when it came to pediatric populations. So back in, published in 2005 now, sorry, not very current data, but we worked on some data from the Dunedin multidisciplinary study of health and development. And this is a birth cohort study. So individuals born in Dunedin, New Zealand between 1972 and 1973 were recruited for this study, and they've been followed up repeatedly over time. And I've heard this described as the world's best epidemiological study. I should point out that I didn't get the funding for this. I'm not the PI, I'm not showing off, but I was just lucky to be able to use these incredible data. So we focused on data, 1,037 participants, and data were collected when they were 5, 7, 9 in childhood, and we looked at sleep problems and symptoms of anxiety and depression then. And then we looked at diagnostic interviews of anxiety and depression aged 21 and 26 years of age. And this is what we found. Those children who were considered to have persistent childhood sleep problems were more likely to be considered to have an anxiety disorder later in life as compared to those who didn't. Now, what we weren't expecting in this particular study was this difference with depression. So we found a specificity for anxiety. We didn't find the same for depression. So it didn't seem to matter whether a child reported persistent anxiety or not, or whether their parents reported that. There was no difference in terms of later anxiety. And there have been a huge number of studies looking at these longitudinal associations over time since that point. And there have also been systematic reviews and meta-analyses of this topic, and it's all been brought together now. And I think if we look at the literature overall over the course of time, we can see that it does seem that sleep difficulties predict later anxiety and depression. So my specificity hasn't been replicated, but the general finding that early sleep problems are associated with later anxiety and depression has been found. It also seems that sleep difficulties may be one of course, many risk factors for other things as well, such as children may be more likely to show alcohol abuse, for example. And there's less evidence for the converse direction of effect. So less evidence that a child that's considered to have anxiety and depression goes on to experience sleep problems later in life. So it seems to be this more evidence for the other direction of effects. And as I mentioned earlier, when we're thinking about sleep problems, this can mean so much. Lots of the literature to date has focused on insomnia, but also variables such as short sleep. And I think clearly there needs to be more longitudinal studies because we're very much limited by the data that have been collected. And historically, sleep wasn't considered very important. So if it was included in these longitudinal studies, it was really an addition. It wasn't measured as well as it probably would be now. So we need to keep collecting data of this type to understand these details, these associations in much greater detail. So moving on to the part of the talk that you are hopefully interested in, how have sleep studies been important in contributing to our understanding of these links over time? Well, I think everybody understands the twin design here, possibly apart from my mum, so I'll just go it through just for her sake. But with twin studies, we compare the similarity of identical twins, monozygotic twins who are genetic clones of one another, with dizygotic twins who share on average half of their segregating genes. And we do this in order to draw conclusions about the magnitude of genetic, shared and non-shared environmental influences on traits. So shared environmental influences are those that act to make individuals within a family more alike, whereas non-shared environmental influences are those that act to make individuals within a family less similar. So you can imagine, for example, how peer group could act to make two siblings within a family less similar to one another, for example. So what have we looked at? Well, over the years, we, as well as many other teams, John's team, for example, have looked at the heritability of different sleep variables to understand more about to what extent are genetic factors important in explaining differences between us or within populations. And we recently reviewed this literature, and this was led by a colleague of mine, Juanjo Madrid Valero, shown in this picture here. And actually, he's led almost all of the twin work that I've been doing for some time now. So he's been very centrally involved in that. He's very interested in the statistical models that are getting increasingly complex. So he's been really quite significant here. But we reviewed this literature together, and we found, as won't come as a surprise to anyone, that all of the sleep variables we looked at appear to be heritable to different degrees. So sleep length, quality, diurnal preference, and insomnia, for example. And really, as I said, that should be no surprise, because anyone that knows this literature, and I know that you all do, knows that, you know, most of the complex traits we look at, in fact, pretty much all of them, are influenced to different extents by genetic information. And for anyone who's not convinced, I recommend that you read Tinker Polderman's review, which has been informally referred to as the genetics of everything. She analyzed all of the twin data on different complex traits and found that they were all influenced by genetic factors. We do, of course, find differences between heritability estimates, which could reflect sample differences. And I was really pleased or interested to see your data earlier, John, where it aligned very much to data that we'd found, so the results we'd found, because often, of course, heritability is a population statistic. So it's interesting to compare different populations to see whether there are differences there. So that was interesting to me, very interesting. But future work needs to identify moderators. And my colleague here, Juanjo Madrid Valero, is from Spain. So one of the questions we've had over time is the difference in sleep. So he refers to the siesta, for example. We wondered how that might be significant, possibly when we were considering genetic and environmental influences on traits. So that's something that we've been discussing over time. But there certainly needs to be further research looking on moderators. And that's why it's so wonderful to hear about all of this terrific work in Brazil focusing on twin samples. So we've also, over time, been very interested in developmental questions as well. John said he only focuses on adults. I've done lots of the children end of things. So this is a collaborator I work with called Katie Lewis at the University of Cardiff. And together we reviewed some of the literature focusing on children and adolescent to try and understand more about the effects of development on some of these results. And I refer here in this table to just some reviews of the literature, meta-analyses, two of them, I think I've authored, the ones with Juanjo Madrid, but other ones are by other teams. And you can see here that overall, there doesn't appear to be a great deal of evidence supporting the idea that genetic and environmental influences on these sleep phenotypes looked at change over time, although there is some evidence to support that. So if you look at the first row of data here, this is a study that looked at sleep duration and looked at all of the literature, and they showed that there was a lower genetic influence on infancy when looking at sleep duration. And that could be because of the more significant role that shared environment plays earlier in life. And I know that that's one of the questions I had for one of the presenters earlier, which I thought was really fascinating work when she was talking about the dental work. So another way that we have started using twin data to understand sort of variables that go sort of beyond understanding just the heritability of variables on traits is to think about some of the leading theories of some of the sleep disorders that we're interested in and seeing how twin models can add to this. So I'll tell you about a few of the projects that we've been involved in this area. And I haven't actually presented slides on this because they're not focused on twins. So some of them focus on polygenic risk scores. So I thought that that might be slightly outside of your central interest here. But we've been very interested in these are different theories of insomnia that focus on insomnia. And this first, that one, oh good, I've got the right button. So this theory it's one of the leading theories and lots of discussion about this, lots of interesting about this, but there's this general idea that when we think about insomnia, we can think about different types of insomnia, and the different types can focus on sleep length, so objectively measured sleep length. So there are some people who experience insomnia and they just can't get much sleep. They sleep for just a few hours a night. There are other people who experience insomnia, but they're getting quite a lot of sleep. That may sound like it doesn't make much sense, but perhaps if you're trying to get 10 hours of sleep and you're taking ages to nod off, you're waking up during the night, you're waking up in the morning, it's unrefreshing, it's impairing your life. That's still insomnia. It's just a slightly different type to the people that are getting short sleep. So it's been proposed in this theory that I keep worrying I'm going to press the wrong button here. But the insomnia with the short sleep duration is the most biologically severe subtype. So this has been proposed without a great deal of evidence, or at least without twin data trying to look at this, or without polygenic risk score information. So one of the projects that we worked on was to look at heritability of insomnia variables in those who had short sleep and those who didn't have short sleep. And we didn't find a great deal of support for this theory, but I should point out that actually we were limited to the data available. So we didn't focus on adults. We had to take a different cutoff. We didn't look at objectively measured sleep. So we're hoping to extend this and look at this in other ways, because we think it's so important to use everything we can learn from these twin studies to test some of these leading theories in the field. Another theory that we've also tested, again, I didn't put slides in because we focused on polygenic risk scores rather than twin data, is this model here. Many of you will have heard of the 3P model of insomnia. So the idea here is that people develop insomnia because they have a predisposing factor. So something in their lives, perhaps a genetic vulnerability, makes them more likely than other people to experience insomnia. And then there's a precipitating factor. So something can happen in your life to have that first episode of insomnia. Perhaps you lose a loved one, for example. So that can trigger that insomnia. And then there are these perpetuating factors which make the symptoms continue once they've arrived. So it's this 3P model, and it's a really leading model in the field. But again, very little data testing this theory. So we looked at the first 2Ps. So we looked at underlying genetic vulnerability and environmental stresses triggering insomnia symptoms. And we found that those with higher polygenic risk score were more sensitive to these life events, so more likely to experience insomnia symptoms following these life events. So we found, I think one of the first studies, that there was some support for this 3P model of insomnia. Very small effect, but still a significant finding that we hope to follow up. But as I said, no slides on that, but I can send you the papers if anyone's interested. So we have, we have, oh, I'm going the wrong direction, I think. Oop. See if I can go back. Yes. So we've also been very taken by some of the cognitive models of insomnia. So these models are thinking about some of the cognitive factors that are associated with insomnia symptoms, such as Alison Harvey's model of insomnia, and also the idea that mindfulness can be an important factor in relation to insomnia symptoms. Certainly, mindfulness interventions have been proposed for some people experiencing insomnia symptoms. And so I'll just give you a little bit more information here. We know that there can be dysfunctional beliefs linked to insomnia symptoms. So as an example, somebody with insomnia may think that they need to try harder to sleep when they're not able to sleep at night. And that's dysfunctional, because if you think about sleep, at its very best, it's a very natural process. You're born able to sleep. It shouldn't be effortful. It should be something that you can do without trying. And in fact, when you start trying, that's when things can go a little bit wrong. We also know a little bit about pre-sleep arousal when it comes to insomnia symptoms as well. So there can be this idea that when you're trying to go to sleep, you can have thoughts racing around your head. And there can also be somatic arousal. So you can have jittery feelings within your body, again, preventing sleep. And as I mentioned before, low levels of mindfulness have also been linked to insomnia symptoms as well. So we wanted to see a little bit more about how genetic and environmental influences influence some of these factors that were linked to insomnia symptoms. And these papers were led by a PhD student of mine, shown here, Mel Schneider, and she looked at all of these different factors within a twin model and found that non-shared environmental influences appeared to be particularly important for all of these cognitive factors, and more so than most of the other factors that we have typically considered in terms of anxiety and depression, for example. When we get to this last column of the data, you can see that she also looked at the overlap between mindfulness with insomnia, anxiety, and depression, finding some genetic overlap. And I end on that note because this means that I can, move on to thinking about how sleep and mental health fits together and what twin studies have told us in relation to these links. So again, my interest in this area started during my PhD, and I when I entered the field in around 2000, I was becoming aware of studies showing that, genetically speaking, there seemed to be strong overlap between anxiety and depression. So they appeared to be part of the same genetic cluster. So I was very interested to see whether sleep was part of this same genetic cluster. And this is the work that you're doing at the moment as well. So we looked at this in a variety of different studies and found that indeed there was this robust genetic overlap between depression and sleep quality, and the genetic correlations are about 0.6, 0.7, and between anxiety and sleep quality, which are around 0.5, 0.6. So we then moved on to look at some of these longitudinal models. So we had learned a little bit about these phenotypic longitudinal models and the idea that early sleep problems predicted certain psychological difficulties later in life. But we were interested in trying to understand this from a twin perspective. So to what extent were the same genetic and environmental factors influencing sleep problems early in life, also influencing anxiety and depression, for example? And so in one of our early studies, we looked to see whether sleep problems predict depression to a greater extent than depression predicts sleep problems, whether there was stability of sleep problems over time, stability of depression symptoms over time. And we wanted to understand more about the magnitudes of the genetic and environmental influences on the phenotypic associations outlined above. And I certainly don't expect anybody to look at the next twin model I'm going to show you, because it's got lots of different numbers on it, but just to see that the bold pathways are those that we found significant effects of. So we looked at a study of 300 twin pairs. 250 of those pairs took part in wave 2, 50 dropped out, unfortunately. And we looked at the twins when they were aged 8 and then aged 10 years of age. We measured sleep by asking parents questions. So we used something called the Child Sleep Habits Questionnaire. And then we got children to rate their own depression symptoms using the CDI Child Depression Inventory. And there's 27 items. And for each item, there are 3 options. So the children choose between items such as, I have fun in many things. I have fun in some things, and nothing is fun at all. And these were the phenotypic correlations showing associations between sleep and depression at age 8 and 10 years of age. And this is our cross-lagged model. And like I said, I don't expect anyone, especially as the last lecture of the day, to be reading all of these different numbers. But overall, we used path tracing rules to decompose these associations, finding that sleep predicted depression at 10, as we had predicted. Depression at 8 didn't predict sleep at 10. So again, more evidence for the idea that sleep can predict later depression, but less support for the other direction of effects. The stability of sleep appeared to be due to genes. The stability of depression, mainly due to non-shared environmental factors, and the cross-lagged link between sleep at 8 and depression at 10 was mainly due to genetic factors. So which genes are important? And certainly some people have been thinking about this. This is the big, big question. And actually studies are getting bigger and better all the time. And this is an area that I haven't personally been involved in for some time now. But I just really wanted to point out the magnitude of some of these studies that are going on at the moment to try and figure out this question. So this is a study by Watanabe, and they focused on over 500,000 cases and almost 2 million controls, and they identified 554 risk loci. And the GWAS SNPs explained just 17% of the heritability. So there's this issue of missing heritability that we're also aware of, that we know from these twin studies that different traits are heritable, but we simply can't specify the genes that are involved. And I think there are different reasons for that, including possibly the idea that we don't always consider gene environment interplay, for example. It was also noteworthy to me, given my interest in sleep and mental health, that some of the variants that were identified in this GWAS have been previously associated with certain psychiatric variables as well, suggesting this idea that there are genes that impact different phenotypes. That could explain some of these links. Which environments, of course, no lecture can go into all of the information, but in our own work over time, we've tried to identify some factors that could be important in childhood sleep problems and in relation to certain aspects of mental health. And we've considered factors which we think are important, such as stressful life events, maternal depression, family conflict, and family chaos. And we've looked at some of these variables in twin models. So finally, I would just really like to talk a little bit, as I mentioned at the outset, about the public communication of some of this information. So one of the areas that we are encouraged to work on is communicating with the public, because of course the public pays for so much of our work, and the reason we do it is to improve people's lives. So some of the projects I've been involved in recently aren't going to get me a promotion at work, but they've been a lot of fun. So I wrote a children's story designed to help children relax at bedtime, a popular science book, and some sleep tips as examples. So I've become sort of more and more interested in this area, which I've enjoyed over time. So it made me think a little bit more about communicating this information, because I think it's hard, actually. You know, we're trained to write scientific papers. It took me at least a year to figure out how to write a scientific paper. And now trying to write in a different way is so challenging. But I wondered a little bit about this public communication of information in particular surrounding sort of twin work and some of the language that we use and some of the concepts that we try to share. So I worked on a paper with, again, Juanjo Madrid, but this was really piggybacking on a study by somebody called Julia Kovas, who's a professor at Goldsmiths, a colleague and friend of mine. And she has got a study running called the International Genetic Literacy and Attitudes Survey. And I asked her if I could include some questions about sleep and about heritability, and to see what people thought about them and try and analyze what people understand about this topic and what they do with that knowledge that they have, or that, the way they believe that they understand it. So in our study, we looked at 3,658 participants. They were all over the age of 18 years of age. This is the breakdown of sex. And we asked the people in this study, if a report states the heritability of insomnia is approximately 30%, what would that mean? And A, they could choose one of these. A was, if someone has insomnia, this is approximately 30% due to their genes, right? So I have insomnia, and that's 70% because my work's so horrible at the moment, but it's 30% because of my genes. B, approximately 30% of people will experience insomnia at some point in their lives. So I've got a 1 in 3 chance of experiencing insomnia. Genetic influences account for approximately 30% of the differences between people in terms of insomnia. So if we're thinking about everyone in this room, why is it that some people have higher insomnia scores than others? Well, that's because of genetic differences between us, and that's the correct answer. Or D, there is an approximately 30% chance that someone will pass insomnia onto their children. So if I have insomnia and I have 3 kids, one of them will probably have insomnia. So these were the, so this was the correct answer. And as you can see, less than quarter got this correct. So most people don't really understand this term. They're hearing this term in the media. They're seeing this term all the time, but they don't understand what it means. In fact, the minority understand what this means. And I don't know if you've had this experience, but I've worked, for example, with brilliant molecular geneticists, absolutely brilliant, and they don't understand what heritability really means, because they're focusing on specifying the genes involved in the process. But within this field, we have very sort of limited little areas of expertise, but we can't communicate with each other perhaps as well as we think. And I haven't shown this here, but when we looked at people that had scored well, even some of those hadn't got this right. So there are lots of challenges here. And I think perhaps even more noteworthy was this. So we gave people these scenarios where we kind of encouraged them to think that something had a genetic etiology or it had an environmental etiology. And we then asked them about different treatment options and said, well, how good do you think this treatment's going to be? So let me give you these scenarios, and everybody got all of the scenarios. It was in different orders. So the genetic etiology was this. Peter is suffering from insomnia. He thinks it is probably because of his genes. After all, his mother, uncle, and grandfather have all told him that they suffered terribly with their sleep too. And then we gave the environmental etiology. We counterbalanced the order. So Robert is suffering from insomnia. He thinks it is probably because his job is so stressful and he has a lot else going on in his life. And I haven't included all of the results because it would just be slide after slide after slide. So I'm just going to show you one result that I thought was quite interesting. So when people were asked in relation to these scenarios, to what extent are talking therapies very or extremely effective, you can see that those in response to this environmental description thought that talking therapies would be more likely to be very or extremely effective, whereas those in the genetic etiology scenario thought they'd be less likely to be effective. And for those of you that know about insomnia, we know that the first line recommended treatment for chronic insomnia is CBTI. So it's really interesting that some people think that these talking therapies are going to be less effective because of their belief about the etiology of a certain situation. So beliefs about treatment effectiveness was linked to perception of etiology of a sleep problem. So that's all I really wanted to tell you today about my work in this particular area. But I think it's true that sleep very much does matter. That quote that if sleep doesn't serve an absolutely vital function, it's the greatest evolutionary, the greatest mistake the evolutionary process ever made, I think is a great one. I think twin research in particular has helped us understand more about sleep. We understand more about the heritability of sleep variables. We understand more about development over time. We understand more about some of the theories of sleep. Twin research has helped us understand the links between sleep and mental health, both concurrently and over time as well. But I think overall, we also need to just pause and think about communicating this information and the potential implications of that. But that's all I have today. So thank you very much. Thanks for listening.
Wow, what a grateful talk. Wow, I'm very impressed. Thank you very much, Alice.
Thank
Excellent.
you.
Yeah, so I'm speechless. I think, can you hear me, everyone? Just check, because I can't hear myself right now. Excellent. So Alice, it's a pleasure to meet you, though online, unfortunately. And it was very impressed. I mean, it was very interesting how you anticipated in your talk every question that I could have. I don't know if anyone else had the same impression, because you dealt with, for example, the first question that came up to my mind was what it comes first. So it's sleep problems or anxiety and depression, and you tackled that from start. So I think it was amazing. And I wanted also to not only thank you for your very enlightening talk, but the way you are careful and thorough in your research program. So it was really delightful to hear you. And I move on to the questions from the audience. So first question, Alice, is, Claudio?
Yeah,
was
there's
it
a question in the
yeah.
chat. Yes,
Yeah,
okay.
I will start with the chat one, the first one on the chat, and then we can move on to the audience at UFPI, if anyone can help me there. Anyway, so the first question is how the heritability of sleep duration changes over time. So could you hear me well?
Yeah.
Okay.
So, oh, thank you. So the question was about the heritability of sleep duration over time, wasn't it? Yep. Now, I think there have been some meta-analyses on this and some reviews on this, and there have been mixed results from those. I think one of the reasons is that in one of the meta-analyses, the focus was on participants over the age of 6. And the reason for this was that, because I was an author of that, so I know a bit about it, but the reason for this was that we were very aware that young infants will be napping and sleep patterns were still being established. So we wanted to focus on after that period. But in another review that focused on the whole lifespan, they did find that genetic influence in very young children was lower, perhaps meaning that shared environmental influence was having more of an impact. So babies are, of course, in the same family, being raised by the same parents. We also know that, of course, parenting can have a non-shared environmental influence, but certainly on the field as a whole, I think that where we do see shared environment, it's at the earlier stages of life. So that could be one explanation there.
Excellent. I'll move. Well, maybe perhaps do we have questions at the audience over there? No? Yeah, we have one.
Hello, thank you. I'm a psychology student here at the University of UFPI. And I had a very practical question. You said it was a lot of work to do the article with the results and everything. And I wondered if you had an estimation of how much work it needs to publish then the books for the kids and all this divulgation program. If you can tell us more, please.
Brilliant. Great question. I think I'm not sure about Brazil, but in the UK, the system is not set up massively to support these initiatives. I think there's a focus on, we are encouraged to communicate with the public, but then we have to show the impact. So there are all kinds of hoops we have to go through. But for me, it was just something I wanted to do. So I thought, well, I'm just going to do this. And the biggest challenge was actually getting a publisher. So I think lots of people want to publish children's books. So I emailed quite a few people and they said, well, they didn't reply. And then eventually I spoke to somebody who said, well, actually, sleep is really important. There's a book called The Snail Who Wanted to Sleep or something that had become a bestseller. So in their publishing house, they were suddenly interested in children's sleep. So they were, and then we had discussions and then we did a proposal. And then we actually, being scientists, did some pilot work because I thought I can't release this book without checking that it works okay. And actually, it turned out to be a collaboration. So I had a colleague who writes children's stories, and together we worked on it so that I had some, I didn't go too far wrong in that area. And the book company we focused on, they really focus on artwork. So they got a great artist to join the team as well. So I think often, and I say this, from that project, but also from all of the science work that I've ever been involved with, collaboration is everything, because none of us have all of the skills. So to work with people who are good, but in particular that we like, is always wonderful, I think, and makes projects fun and sort of happen. Yeah. Thank you. Yes.
Oh, there is another one.
Thanks, Professor, for your talk. It was amazing. There is a professor called Renata, recently hired here, who made a book for children to improve their sleep and things like that. She's a clinical psychologist. And I liked a lot the fact that you made the relation between CBT and genetics, what isn't made frequently. So I was asking about how did you measure distorted beliefs in your study? I was curious about that.
Thank you. Really good question. So yeah, I guess when I was an undergraduate student, I was at Oxford, and my tutor was Alison Harvey, who had developed this cognitive behavioral model of insomnia. So then I did my PhD in social genetic developmental psychiatry, and it seemed worlds apart, as you said. Usually we don't think of genetic and environmental influences on these cognitive factors. So really from the start, that was what I wanted to do. But there weren't data available. So I realized I had to collect my own data over time. And, as John will know, because he runs twin studies, it's so hard to get large samples of twins and collect all the data you want. And they're usually collaborative. And so you only have a few questions. So over time, eventually I got my own grant money for that particular project. And we used the dysfunctional beliefs about sleep questionnaire. So we used lots of questionnaires about these cognitive factors. We used, I think it was the Bayer abbreviated questionnaire to look at the mindfulness items. We looked at the pre-sleep arousal scale. So it was all questionnaire based. We put it in booklets that we sent to the twin samples. And then they completed it, and then we analyzed the data over time. But yeah, thank you for that question. Yeah, great. Yes.
Well, I'd like to know if have you ever read anything related to medicine treatment and for children or adults, twins? Do you know anything about it?
I do. I know a little bit. So that's not my research area, but from what I've read, as you say. So one of the things that we often talk about actually in the children literature is the use of melatonin. So this is off-label, meaning that it's not approved for that purpose, but doctors will make their judgment call about whether to give it to specific children. And there's been quite a lot of controversy in the literature about the use of melatonin, partly because there have been studies in animals, for example, showing that it can affect sort of reproduction patterns. Or I think there needs to be more longitudinal data. I think most doctors that you speak to aren't worried about it. Most families you speak to, in my experience, aren't worried about it. Yeah, you know that. Yeah, but it's something that I think there needs to be more research on, for sure. Yeah. Thank you. And I think as another factor to do with research is, obviously within the literature, cognitive behavioral therapy for insomnia is absolutely, the most evidence is that is what people with chronic insomnia should be given to support them. But I think most people aren't necessarily aware of that. So they go to their doctor wanting sleep medicine because they think it will be a quick fix, which of course it often really isn't. I mean, of course, there are some situations that it may be totally appropriate, but over time, it's usually not recommended. Yeah. Thank you.
I just want to step in, and if there is any questions from the audience, I just wanted to add another question from the chat.
Thank you.
And then you can move back to the audience just in a bit. So someone asked, it's actually right in the right time. So someone asked, maybe it's not the best question because you say all that in your book, probably. But what would you say are the best tips to sleep better?
Yeah, that's a really important question, I think, and the one that so many people want to know. So I would say that there's quite a lot of suggestion that regularity is really important so that our bodies know what they should be doing at the same time. So it supports our circadian rhythms. And I think that is one of the biggest tips, and lots of people seem to support that. Another one I would have said is light. So we think a lot about light and blue light at night, and Harvard Medical School, I believe, recommended not having, blue light 2 hours before bedtime. But I recently read a review by Michael Gradisar and colleagues that really challenges some of those conclusions. So I haven't read the review yet. I've just seen his commentary on it, which is like, we're all saying that it's light. We're all saying light's so important here, but we need to look at this data and really look at it closely, because actually the effect is less big than we thought. But there are lots of other things as well. I mean, even lifestyle patterns, so sleep hygiene, thinking about sleep hygiene, thinking about things like caffeine, that I just had a large, strong cup of caffeine a little while ago. I certainly don't practice what I preach, but that can impact some people. And there are data to suggest that some people drinking caffeine even in the morning can impact their sleep architecture at night. And then, of course, anyone suffering with insomnia, they should see their GP who can consider their case, but often CBTI will be something that's recommended. But I could go on and on with tips, but they're the main ones, I think.
Thanks. Oh, yeah, so GP, it's a doctor in England, in Britain, in United Kingdom, isn't it? Do you call GP there?
Oh, GP, yes, yeah, a medical doctor, yeah,
medical
absolutely.
doctor.
Yes, which
Yeah.
I'm not. So anything I tell you, take that into consideration, that I'm not clinically trained. So definitely speak to somebody who is.
Yeah, I'd like to add, because I don't think we have many parents in the audience, so lots of young people. So I'm a mother myself, I'm a mom, and it's really hard to put your kids to bed. So I can only imagine, well, how these factors interact with genetic factors as well. So we have another question, and I think we still have a bit of a time. And yeah, when you studied the non-shared environment of the twins, did you find any factors related to insomnia that affected one twin but not the other? Did you have the chance to evaluate those non-shared environments?
That's a really good question. So non-shared environment. And I forget who was saying earlier, but somebody was talking about how twin studies don't only tell us about genetic factors, but are so important in telling us about environmental factors as well. And I totally agree with that. And one of the projects we've worked on recently, again, led by Juanjo Madrid. So I want to make that clear, because rather than steal his work, but he included an MZ differences component where he was trying to look to see whether media use could impact sleep. And he found that even after controlling for those shared environmental factors, it appeared to have a role on sleep. And that's something we published in the journal Sleep a little while ago. I think it was last year. So yeah, I think that MZ differences design is very interesting, powerful, and that there's a lot that can be learned from it. Yeah, thank you. Yes.
Yeah, great. I was just going to say that. Anyone else?
Thank you. Just maybe a rapid one. You used the word sensibility, talking about the sensibility with anxiety and insomnia. And I just wondered if you think that these kids that have sensibility with anxiety and insomnia has a general sensibility about the world. Maybe they are receiving more information, it's harder to process, or what do you think about it?
So this general sensitivity, I think it's really interesting, and it's certainly something, I mean, when you think about the work of Talia Elia, and I know that her group was presenting earlier, she's done quite a lot of work on anxiety sensitivity. So this sort of sense, exactly as you describe. And I think that could be very important in sleep and anxiety and variety of other things as well. This general sensitivity. And I guess when we consider this from a gene perspective, thinking about, the pathways, because it's so hard to split everything apart or to try and understand how things fit together. But I think that they're absolutely general sensitivity is very important for a variety of different phenotypes. Yeah. But a great question. Yeah. And something that's measured in twin studies. Yeah.
We still got a couple of questions. So another one is, thanks for your talk. Sorry, I keep moving my screen because I'm using my mobile as a microphone. So sorry about that. Thanks for your talk. I agree about the importance of communicating results, mainly explanations about gene-environment interactions. Do you have suggestions about how to communicate them?
Yeah, really. I think we're just learning, actually. In fact, with Yulia Kovas, who runs this eyeglass study, so the sort of bigger study asking these questions, we're currently trying to put in a grant, actually, to really think about how to communicate this properly. And one of the things we hope to do is to talk to a load of sort of thought leaders in different areas, whether it's judges or, you know, all kinds of people, and bring them in and try and understand how to communicate this accurately and how to sort of reduce misinformation about this topic. But I don't know. I mean, I always, you know, we all always try our best, but I think there are lots of ways in which you can accidentally describe something that people don't understand. And perhaps just thinking, and, you know, as I spoke today, I realized that there were lots of things I didn't define on the outset, which some people probably thought, I don't know what she's talking about now. But, you know, perhaps trying to be more mindful to that and thinking, what does everyone need to know? And perhaps erring on the side of over description than under description. Assume that people don't have the knowledge that, you know, people do as experts in their topics.
Yeah, excellent. I look forward to that. I mean, I hope you get the grant for doing the kind of.
I don't have a great success rate, so we'll see.
Don't we all? We should keep trying. So the last one we have here for now, it's oh, sorry, I was a bit late, and it was related to a previous question. So how about hypersomnia? Is it also related with depression and anxiety in children?
Yeah. So hypersomnia is also in the diagnostic criteria for depression. So it can be, yeah. I'm not so sure with anxiety, although again, you know, this collaboration we spoke about, also with interdisciplinary collaboration is always really interesting. So I had an artist come to see me quite recently, and she was doing a project on anxiety, and she was interested in sleep. And as somebody who studied sleep and anxiety, I've always been interested in insomnia in relation to anxiety and problem sleeping in relation to anxiety and perhaps stress, which can impact our sleep. And she came to me and she sat in my office and she said, so I want to do this study because I think when you're feeling really anxious, you just go to sleep to shut the world off around you because life is so hard. And it really stopped me and sort of made me think a little bit more about that. And so I think there's lots more that can be done. But I think much of the research does focus on problem sleeping and insomnia when we think about anxiety. And I don't know if there's a great deal of research looking at hypersomnia, although of course there is in relation to depression. Yeah, thank you.
Well, I think we are heading towards the end, right, Claudio and Emma? And I just would like to thank you again, Alice, for the amazing talk, and the audience for the very interesting questions as well.
Yeah. Absolutely. It's such a pleasure. Thank you all so much. And brilliant questions as well. It's made me think. Thank you.
Thank you, Alice. Well, I think it's time to close this event. Emma, would you like to say something before I close the event?
Yes, I would like to thank everybody, to thank Alice and all the speakers today. And especially, I would like to thank our team, naming Ricardo, Tânia, Bella, and Lilian, especially, and all our organization committee that I will thank by the name of Claudio. Thank you, everybody.
Okay. Well, it was a very productive day. We had a lot of talks with a very high level, scientific level, a very, very special day. Emma, you and the organizing committee, congratulations to you, because you really organized a very, very good scientific meeting. So it was a very good day. And I would like, on behalf of the organizing committee, to close this event, to thanks everybody that worked with us. It was a very special day for our group, for our research project, our thematic project at FOUSP, and our project inside university. We have this also this group in the university. And it was a very special day. Thank you for everyone. And well, see you in the next. I think we'll have to organize another one. And thank you very much for all the speakers, everybody who is in the room, everybody who followed us in the Zoom meet. And see you in the next event. Bye-bye.
Obrigada, pessoal. Obrigada, Emma. Boa tarde. Tchau, tchau.
Tchau, tchau.